Hi, I'm Dr. Dave Wendell, and welcome to Tuesday Night Tidbits. We're here to help you get healthy, naturally, of course. And tonight we're going to be talking about the 21-day week. 21-day week, wouldn't that be nice if you had all the time in the world to do what you want? But first, we always have to talk about the spine. When we talk about the spine, why? My chiropractic roots. The spine houses our spinal cords. Brain sits up in the head, sends information down the spinal cord to all over the body. Each nerve goes to various things, muscles, organs, immune system. When we as human beings accumulate stress, we cause the bones to misalign. Millimeters we're talking, not yards. And when it does that, it puts pressure on the nerves. Now we have muscle, nerve, bone involvement, soft tissue involvement, and we start to develop arthritis. Your medical providers will tell you, well, you know you're getting older, that's normal. No, it's not. It's never normal to develop arthritis. Doctors of chiropractic are able to recognize subluxations, adjust the spine, restore movement and health back to that area that's subluxated, getting energy flow, life flow, vital life flow back to your body, and stop that arthritic connection that's developing. And so we always have to talk about that because why? We're looking at ways to reduce stress in your body. And that's where we use a 21-day week. Well, how does this really work? We know we really only have 7 days a week, but if you know that and do the math, 7 days, 21, we know we're talking about 3 parts of our day. And so it's real simple with a 21-day week. You have the part for yourself, that's the me part for others, if we get the H in there, and part for family. Right? Those are the 3 parts. You see, when I go to work, patients ask me all the time, how can you be so giving? You give of yourself all day long and you never seem off on that. Why is that? Well, because I practice a 21-day week. So important. When I get up in the morning, and I've done this for years, morning is for me. It's going to sound a little funny. Me. I have to fulfill me. If I'm going to give care and be with other people and give of myself for the next 12 to 16 hours, I want to feel fulfilled. I don't get much fulfillment, that doesn't sound right. I don't look for much fulfillment outside. I look for it inside. What can I do? So my morning, when I take care of me, is about getting up and journaling, reading, maybe looking over some scriptures or literature, taking time to exercise, which is really important, and then getting a good breakfast, a good shower, and off to work. It's about 2.5 hours for me. But when I leave my facility in the morning, when I leave my house in the morning, I'm fulfilled. I've taken care of me. So now when I get to work for 10 hours, 8 to 6, I'm able to give of myself, and it doesn't matter. And then after work, I'm able to give to my family. Whether they're present, whether it's on the phone, I have time to give to them because I've taken care of myself first. So we divide the day into 3 sections. And by doing that, we're able to just totally take care of everybody. And I had a patient once say to me, don't you feel selfish taking that me time? I said, absolutely not. How many times do we give of ourselves and give everything we have, but then all of a sudden we start to get a little grumpy and not really want to give? And I don't have that issue. Why? Because when we take care of ourselves first, not in a selfish way, but in a way to fulfill our needs and fuel our souls so that we can just give everything we have, every last ounce to others. When patients come in, that's what it's about here in our office. It's about giving. When we get to family, it's about giving and never feeling that you've been slighted some time because you didn't take time for yourself. Think about all that we do. We get up, we go to get ready for work, we go to work all day, whether it's 8 hours, 10 hours, 12 hours, and we're giving. And when we get home at night, our families have needs from us that we have to give. And how many times and how many people do we know that they begrudge that? Oh, so-and-so at work will always monopolize my time. Oh, when I get home, the kids, the this. You should never have that feeling. And if you're practicing the 21-day week where you start off fulfilling your needs first so that you can just give the rest of the day, you've experienced some great moments, great days. And so it's so important to make sure you develop your morning routines. But your morning routine doesn't start in the morning when the alarm goes off. It starts at night. If we're staying up till 11, 12, 1 o'clock watching unnecessary TV and doing things that really don't fulfill our lives, that takes away from our day one. Patients all the time say, well, I can't get up any earlier. I'll never get any sleep. What time are you going to bed? Oh, 12, 1. Well, what do? You get home at 7 from work. Well, I get home, I have dinner with the family, and then from 9 to 12 or 9 to 1, I'm watching TV. Awesome. What is fulfilling you from the TV? Well, nothing. I'm just watching it. Shut it off. It's a TV. Or DVR the programs you really want to see and watch them at another time. But first and foremost, start off fulfilling your needs so that you can just give all day. I'm Dr. Dave Wendell, and I want to be your inspiration for healthy living.